As our loved ones age, we often have to make the difficult decision of moving them into long-term care.
But sometimes when those facilities make mistakes, there are few consequences. Only News 3's David Douglas spotlights one such case and gets a state agency to admit it should have done more.
I don't want this to happen to anyone else ever again.
The Mineral Point Care Center had been a great place for Barbara McGrath to recover from spine surgery until a day last September when everything turned on a dime.
I said, "Mom, what are you experiencing?" And she choked out, "I can't breathe, can't breathe." So I told the little CNA, I said, "Call 911, run down the hall and call 911. And she said, "I'm not allowed to call 911.
Just the first of 5 times daughter Sue Castoris and husband Jim say care center staff told them they couldn't or wouldn't call an ambulance for Sue's 91-year-old mother they believed was having a heart attack.
The nurse said, "I'm going to call her doctor." I said, "No, call 911 now."
In this kind of a case, seconds count.
So Jim went outside, listening for sirens, watching for an ambulance. Nothing. Back inside, he found the nurse still dialing the doctor.
And I said, "You call 911 right now, and if you don't, I'm going to leap over the counter and I'm going to dial 911 myself."
Iowa County 911, where's your emergency?
Hi, this is the Mineral Point Care Center, and I have a resident with chest pain who needs to be transported to the emergency room.
5 minutes after that call, an ambulance did arrive in time to get McGrath to an Iowa County hospital with her pulse in the 30s. Doctors stabilized her, and though she survived, the failure to call 911 is just the beginning of the flaws we found in reviewing state documents from an investigation done into the Mineral Point Care Center.
I'm not trying to drag that place through the mud. I'm trying to make things better.
By law, care staff must report a change in condition to a physician. It didn't happen. If nurses had reported McGrath's shortness of breath hours earlier, a doctor might have noticed what investigators found. A drug interaction was the likely cause of her emergency. In other cases, residents were given drugs not ordered for them, lab tests weren't completed, and the care center poorly maintained clinical records. The result? 5 federal citations, but no fine. The only requirement? The facility submit a corrective action plan.
I think that it sends a message that you can get away with this. You really don't have to change your attitude. You don't have to change your policy. You don't have to do anything different than you were before.
For this level of violation, they have what's called an opportunity to correct because there's no harm, there's no immediate jeopardy.
Otis Woods oversees nursing home regulation for the state. His staff use federal guidelines to determine the severity of an incident. He admits in this case, they did not conduct an on-site follow-up to make sure that action plan was implemented. We showed him parts of the investigation which found employees were never interviewed by management after McGrath's incident, and no internal follow-up was done. We asked him, given that, could the Mineral Point Care Center really be trusted to make a change?
You make a good point, and upon re-review, it does look like we should have done more, and this is something that I have to look into. It's a good point. Maybe there's a change in practice or policy that should be looked into.
And after a daughter looked into her mother's eyes and thought the worst,
I saw the look on her face and I thought, this is it.
A little hindsight leading to better oversight is what she's hoping will save others.
Some people never have visitors, ever. And what's happening to them? That's the concern.
The Mineral Point Care Center opted not to comment for this story, citing confidentiality. As part of its corrective plan, it promised to re-educate and retest nursing staff, conduct internal audits of records, and make sure doctors' orders were properly followed. DHS does go back and review at random some of the surveys, investigations it does to make sure the proper action was taken. And it seems this case, Sarah, is destined for a second look.
So, David, how can we find out if a facility has made mistakes and then what the consequences are in those cases?
Well, you know, it's a very interesting question because when we started this story and started trying to look into this, we found you can really only find out very basic information, at least easily. So you might not realize an incident like this, which was graded as a low-level violation, was potentially serious. In April, the agency plans to launch a new portal online that will allow anyone access to the kind of deep records that we reviewed for this. And we have a pending, very large open records request with the state. We hope to get that information soon. We will be digging through all of it and try to figure out how often something like this might be occurring.
All right, good to know. Thank you, David.